Welcome students. Today we are going to talk about anatomy of fallopian tube. What is fallopian tube? It is nothing but the tube which collects the oocyte from ovary and transfers it to the uterine cavity. Okay? So what is the location? It is located in the upper border of broad ligament. Broad ligament is the peritoneal fold which covers like a curtain, just like a cloth covers the uterus. When it is covering it like this, so this is the fallopian tube are lying on the upper free border of broad ligament. The dimension of fallopian tube, it is around 10 centimeter long. तो लंबाई कितनी है इसकी 10 सेंटीमीटर. The diameter is around 3 millimeters. It is variable. In some places it is very narrow, in some places it is broad, but on an average 3 millimeter. Now its part. The lateral end is the broadest, and so it is called infundibulum. And infundibulum bears a lot of finger-like projections, just like this. See, you can see finger-like projection here. Here you can see very clearly. And of these fimbriae, one of them is longest and is attached to the upper pole or the tubal pole of ovary. Ovary has got two poles, upper and lower. The upper pole is called tubal pole because it is in relation to the tube, isn't it? In ovary, the upper pole, anterior border, medial surface, posterior border, they are all in relation to this. See, this is the posterior border. Now this is the upper pole, and then this is the medial surface. All these are in relation to fallopian tube. Now you will say how this is medial. See, the ovary actually turns by around 180 degree in nullipara and multipara. In nullipara, it is always vertical, and in multipara, it is horizontal, as you can see in this diagram. So, when we talk about the anatomy, we talk about the nullipara status. There, this is the upper pole, this is the lower pole. So, upper pole is called the tubal pole because it is in relation with the fallopian tube. Then we have got this surface and this surface. So there are two surfaces, lateral and medial. Borders are two, anterior and posterior. So the only lower pole and the posterior border are not in relation with the fallopian tube. All other surfaces and borders and pole of ovary are in relation with the fallopian tube. So fallopian tube is 10 centimeter long. This is clear. Its average diameter is 3 millimeter. This is also clear. Now it's divided into the most lateral part is infundibulum, which has got finger-like projections called fimbria. One of those fimbria is longer and is attached to the upper pole or the tubal pole of ovary. Now, after infundibulum, the lateral 2/3 of the fallopian tube is called ampulla, and the medial 1/3 is called isthmus. Isthmus means a narrow area, isthmus, and then you find a little portion of fallopian tube going inside the cavity of uterus. So that is intramural part of fallopian tube. Clear? So these were the parts of fallopian tube. Now you can see its relation. You already know it is mostly related to ovary, and the broad ligament is the peritoneal relation. Then we talk about the arterial supply, venous drainage, lymphatic drainage, and nerve supply, as in any other organ. So arterial supply. Since it is in proximity with the ovary as well as uterus, it is supplied by both ovarian artery branches and uterine artery branches. And as because of the same reason that it is near the ovary as well as it is near the, and not only near, it is even joining the uterus. So it will be drained by uterine vein as well as ovarian vein. Ovarian vein, which is previously the previous part is called pampiniform plexus, but later on it forms the ovarian vein, right and left. Right ovarian vein is going to open in the inferior vena cava, and the left will open in the left renal vein. Lymphatic drainage will be same as that of these areas. That means pre and lateral aortic, pre-aortic and lateral aortic lymph nodes. So it will be drained by the lymphatics similar to the lymphatics of ovary. Now the nerve supply, it is also same. It has got both sympathetic and parasympathetic nerve supply. Parasympathetic as usual is vasodilator in nature, and it also inhibits the peristaltic movement of fallopian tube. Fallopian tube also has peristaltic movement so as to assist the movement of oocyte towards the uterine cavity and sperm towards the oocyte, so as to facilitate the fertilization. But the sympathetic nerve, they are assisting peristalsis, but mainly the peristalsis is controlled by the hormones. So the function of fallopian tube is actually to facilitate the fertilization. It is acting as a passage for oocyte and the sperm so as for fertilization. So I think you have understood it, and you must be in applied anatomy, tubectomy. You should know about tubectomy. In tubectomy, this tube is cut and folded on itself when it is in open tubectomy, and that's the permanent sterilization in females. But in laparoscopic tubectomy, a portion of it is raised up and a clip is put on it. So that way the pathway of sperm and oocyte is obstructed forever. So this is the permanent sterilization in females. Thank you.